This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page and welcome to another episode of Doc Talks. Doc Talks is a podcast which is produced by the Knoxville Academy of Medicine, by its members and by its staff for patients to provide them with additional information on topics that are of interest, topics that are topical, and it provides a basic informational session for which patients can gain additional information on certain things and thereby be able to have more knowledge about the treatments they seek. And today I'm very glad to welcome Dr. Chris Ciano.
Thank you.
Dr. Chris Ciano is not only, I find out, wears many hats. He's not only a pediatrician, he's not only an emergency medicine doctor, but he also runs his own clinic in West Knoxville that is integrative and functional medicine.
Correct.
Could you let us know what is integrative? First of all, welcome. And second of all, let us know what integrative and functional medicine entails.
Sure. So integrative and functional medicine is sort of bringing the best of both worlds. So the integrative aspect is taking our traditional medicine and providing a bridge over to some of the more natural and functional medicine aspects that we have today. So for example, one of the hallmarks of functional medicine is helping the body to heal itself. And when we allow the body to heal itself, we bring about wellness, and we also bring about, of course, from wellness brings about longevity. And a little difference between sort of traditional medicine, which can be symptom-based, functional medicine and integrative medicine is all about taking the body and trying to help it heal itself and bring it back into balance or bring it back into wellness.
So what exactly, so if I were to go into your clinic, so it's interesting for me, so not only do you provide traditional type medicine as
Correct.
a pediatrics emergency room doctor, but you also provide another sense of medicine. What exactly drew you into this area?
So interestingly enough, my grandmother is probably the reason why I do this type of medicine. When I had first just started medical school, my grandmother was diagnosed with a form of macular degeneration, which was not amenable to any type of treatments at that time, not amenable to surgery or any type of medications that were available. So being the young medical student I was, I went searching. And that landed me to a lot of European sites. A lot of German sites, a lot of French, English sites, Italian sites, where they were using these type of what some might call alternative therapies back then, which have become very mainstream now. So now if your doctor wants to put you on an eye vitamin supplement, he gives you the name of Ocuvite or ocular support, and you go and you find it and you take it, and you get better, your vision is help sustained, but that type of those types of treatments did not exist when my grandmother was having her first diagnosis initially, and she was supposed to go blind within the year. And so she was diagnosed in her 70s, she lived to her 90s, and she maintained her sight using these various therapies, which included at that time large doses of spinach powder, different types of herbal supplements, including periwinkle, different things that help support the vascular support to the eye. And that, in combination with going to DO school, so osteopathic medical school, I was exposed to these different types of therapies that were sort of outside the mainstream of traditional medical therapies. And then my interest just grew from there.
I'll be darned. So we're not necessarily just talking about things that are basically not medicine based. These might be therapies that are medically based that do have proven value, but not necessarily are accepted by the medical community as a whole.
Absolutely, and lots of them have very, very, large amounts of research behind them, but still they're not mainstream. Our healthcare system today, unfortunately, is very symptom-based. There's not a lot of focus on wellness. There are in other parts of the country, for example, in Washington and Oregon and California, there are actually types of physicians that focus on these aspects, and that's all they do. They don't receive traditional therapy or traditional training, rather. So it is being accepted, and it's just sort of an evolving specialty of medicine medicine, which I think one day will actually become its own distinct specialty that will have boards and everything along with it.
Oh, darn. What type of patients do you look for in your practice? What type of patients typically seek you out? If I were a patient and was having an issue, maybe I've failed a traditional medication or failed a traditional therapy, what sort of therapies would you be able to offer for me, and what are the different areas that you cover?
And those are the patients that come to us. So the patients who have failed traditional medical therapies, or they've gone to their doctor and sometimes their physician is not able to get to the bottom of it. And sometimes our clinic operates like Dr. House. So we'll have somebody who comes with a long, very thick chart with multiple testing, but they're still not feeling well. They're still having multiple sort of vague complaints, pain complaints, or sometimes we see diagnoses such as pain syndromes where they don't have any other medical therapies that the traditional medical system can offer to them. So we treat all sorts of gut issues, gut health. We treat.
So what sort of gut health issues would you treat?
So mostly we treat a lot of gut imbalance. So, as we're learning now, there is this axis that exists between the brain and our gut, where the good bacteria, have an actual influence on the neurotransmitters.
So when you talk about gut, you're talking about not just the stomach and the bowels, the entire, entire system, alimentary system. Yes.
Exactly. So everything from reflux to irritable bowel syndrome, which we don't have a lot of medications for, especially if we're either constipation or the diarrhea type, or patients who just want a more natural approach and who want to allow their body to try to heal themselves and get off medication altogether. But gut health is a big thing, a big part of what we do. There's something called dysbiosis, where is the imbalance of bacteria in your small intestine or large intestine. There's something called SIBO, which is can be again all related to dysbiosis of your small intestine, which is small intestinal bacterial overgrowth.
Gotcha.
And we help patients through this process. And you can imagine we don't become sick overnight, so it takes a while to bring the body back into balance. But there's a lot of times we're able to achieve that where traditional medical therapies have not, because they're just so symptom based, where we're sort of based on allowing the body to heal itself.
So one of the things that we see a lot about now, and especially has become even more prevalent, is gluten sensitivities,
Sure.
gluten disorders,
Yes.
celiac disease.
Yes.
Is that something that you would approach also?
We do. So we do treat a lot of celiacs. We also treat a lot of people who we just call gluten sensitive. The medical community right now is sort of going back and forth whether how many people have true celiac disease. I think true celiac disease is probably not all that common. However, the way our grains are manufactured and treated today and exposed to so many chemicals and pesticides that it has become an inflammatory grain. So when you're eating gluten, you're eating a potential inflammatory substance. Now, people who can deal with that fine, then they don't have any other symptoms. But then there's a whole host of people who just respond with eliminating gluten from their diet.
So it's not just the actual protein gluten itself, it actually is the chemicals that are used in raising wheat and raising grains, and not necessarily just the gluten itself.
That's correct.
Excellent. So, well, you touched on pain syndromes to begin with. So if I'm a patient and I'm carrying a certain diagnosis, let's say something like fibromyalgia,
Sure.
or if I'm carrying something, you talked about disorders that are very difficult to treat.
Yes.
What are some of the ones that you treat, and what are some of the therapies that you use?
So that's a perfect, fibromyalgia is perfect example. Mold toxicity is another example. Chronic Lyme disease, again, which is one of those more controversial diagnoses where people just have symptoms after being bit by a tick for years. Those are some of the things, in addition to the more common disorders that we treat, such as thyroid imbalance or hormonal imbalance, weight loss, or some of the things that we treat. But we do have several treatment modalities and protocols for a lot of the diagnoses, such as fibromyalgia, which doesn't have a lot of good standard, traditional medical treatment.
Now, in addition to pain syndromes and gut, if I were a patient and I was otherwise healthy, and I was just interested in seeing a doctor who would provide me with care that would keep me healthy or would keep me in balance, would that be the type of patient you would see also?
Yes, absolutely. So we do see we do have quite a bit of patients who just want to preserve their wellness, or some, are interested in longevity. And you can imagine, if you're balancing the body and you're helping balance the gut and you're resolving any type of small issues that might go unnoticed, even in a patient who feels well and think they're well, but we can make them even feel better, that promotes longevity.
Now, I do know that there's a lot of, people talk, there's a lot of problems or issues nowadays in the general community about people who offer therapies that just don't work, or patients that offer therapies that are just magical type therapies for cancer and things like that. Could you speak about that for a second, and any sort of knowledge you have in that arena?
Yes, absolutely. And we do treat some patients with cancer. We don't treat cancer,
Right.
but we do provide cancer support. And yes, you are correct. Unfortunately, there are some, for lack of a better term, sham type of medical practices where they offer you quick cures and they take large deposits of your money and then they do very little. But for example, we work with traditional medical providers side by side. We work with local oncologists.
And you're a physician.
I am,
Yeah,
correct.
yeah.
And I work with my colleagues, and one of the things that we do for cancer support is high dose IV vitamin C, which people don't realize, lower doses is an antioxidant, but at high doses it's actually an oxidative therapy, and that's how it helps kill cancer. And it helps increase our NK cells, and that sort of works
So
right
it actually
along.
just boosts the body's immunity naturally.
Yes, it doesn't fight chemo. It works right alongside chemo. And in Europe, again, there's so much research on using therapies such as that, like IV vitamin C, to help boost the immune system, fight cancer. There's other therapies like IV ozone, again, used all around the world, just not accepted throughout the U.S. in our traditional medical culture yet.
So what you're saying is not necessarily you would use the therapies that you provide in place of. They would be used sort of in concert with or in addition to the other therapies that these patients might be getting.
That's correct. We prefer that. We prefer to have patients work with their traditional medical doctors, especially with serious diagnoses such as cancer. People do make personal choices sometimes just to forego chemo, and we do help support those patients as well and give them as best quality of life as we can by supporting them. And if there's anything that we can do naturally to slow or impede the growth of a cancer or chronic disorder, then we support them as well.
So we've talked about pain, we've talked about gastrointestinal issues, we've talked about some of the adjunct therapies you provide, we talk about some of the therapies you provide for healthy patients. Is there any other therapies that you would like to talk about, just at least for now, that you provide that we haven't had a chance to touch on?
Just very briefly, there's bioidentical hormones, thyroid support. There are ways to manage these processes as we get older with traditional medications, which can be synthetic. And so just like as the word implies, bioidentical, we use hormones from natural sources. One example is the yam or sweet potato, where we'll get hormones from, and we can supply those to the body in the form of creams or oral lozenges or pellets that you actually insert just below the skin. That, along with using sort of more natural types of thyroid. So instead of Synthroid, which sort of people sometimes don't feel well on, we use Armor thyroid or natural thyroid medication that we can help people who want to have a more natural approach to their illness feel better, and then also use more natural alternatives.
Most excellent. So, you've provided us with a lot of information about what your clinic does and the sort of things that you do, and you certainly have given me a lot of knowledge about the types of medicine that you provide, because I must admit it's not something that, as a pathologist, it's not, there really isn't any sort of alternative that we have to that. So
I understand.
We're just kind of sitting there and doing our thing. But I do want to talk about your office, and I do want to talk about your practice, and I would also like you to mention any information about your website.
Sure.
So if you just let us know, the information will be on the screen for the patients
Great.
as they see
Perfect.
it. But tell us about your office first, because
Okay.
that's pretty cool.
So we are in the Sharon Walker House, which has been fully restored now. It's a pre- or Civil War era house. It has a very old tree in the front of it, but it has been passed through many generations. It was restored completely. It has all of the rooms are mostly intact. We have some original flooring, original brick. There was a physician who practiced there in one of the rooms off the side, and that used to be his residence and his office. So it's just a really neat place, even just to visit and to come by.
And just so people know,
see.
this is that house that's out in front of Academy Sports.
Correct.
It's over there in West Knoxville.
Yes.
So, and
Across
anyway,
from
go
home.
ahead. I
Yeah.
apologize to interrupt. But
No, that's good.
Because I didn't
Yeah,
know the name of the
yes,
house. I knew it was
yes.
like an old house. So,
Yeah, it's across the street from Home Depot.
Okay.
9320 Kingston Pike. But it's just a really neat place to practice medicine. Our patients it's just such a different atmosphere. And that's sort of what our motto of our practice is, right? We practice a different form of medicine, and our office building, I think, echoes that really, really well.
So not like a sterile white environment,
Not
like a
at
regular,
all.
with metal tables in the doctor's office.
Not at all.
So-
Comfortable chairs. Actually, most of our furniture is older and repurposed. And just like that house was restored, our purpose of our practice is to restore the function of the body.
And you've been there since 2014.
2015.
2015.
Yes.
And let us know the address of your website and also your phone number.
Our website is knoxwellnessexperience.com, so www.knoxwellnessexperience.com, or you can just Google Knox Wellness and our name pops up. And our telephone number is area code 865-801-9501.
Excellent. Well, Dr. Chris, thank you so much for joining us here today and providing us with the information about your practice. And I certainly think it gives us a lot to think about in terms of how we address medical choices and medical therapies.
Yes, absolutely. Thank you for having me.
Excellent. And with that concludes this episode of Doc Talks. Doc Talks is produced by the Knoxville Academy of Medicine and is produced by its staff and by its members. People who are, I shouldn't say allowed, but we generally, if you're a member of the Knoxville Academy of Medicine and would like to appear on Doc Talks as well, you can find the information usually on the website or something that would be accompanying this podcast if you would like to join us. And other than that, I'd like to thank you for joining us today, and you have a wonderful day.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.